Hello, this is Dr. Rich Blake from Dr. Blake's Healing Soul. Today we're going to talk about peroneal taping. We're going to use two products that are sold together like Amazon. It's Leukotape, spelled L-E-U-K-O, and then coverlet. And the coverlet is to protect the skin. The Leukotape is the strongest tape that I know. So it's designed to, really stabilize you. So if you're having issues with your peroneal tendon and you want to stabilize the outside, but not have the bulk of a ankle brace, then taping will be appropriate for you. So what we're going to do is try to stabilize these outside tendons called the peroneal tendon. This is the peroneus brevis, which attaches into the fifth metatarsal here. And there's the peroneus longus that comes down and actually helps support the arch. But both of them together help stabilize both the lateral ankle and the lateral part of the subtalar joint and the joint called the calcaneal cuboid joint. So very, very important stabilizing tendons. So we want the tape to help substitute for that. So we're going to use the coverlet first, and we're going to make a J-strap from the inside of the ankle, just below the inside ankle bone, and we're going to come around and up the leg. So here I'm sort of pre-measuring it out and then cutting the coverlet. And it's important that the coverlet really protects your skin. So usually I'll overlap two of them to produce a good taping. So we start on the inside of the ankle, just below the ankle bone. We come around the heel and then up the leg with the first of the two coverlets. And you want to have one that's just a little in front of the ankle bone, and you're going to have a second one that's just going to be behind the ankle bone. So I'll use my first piece to tell me the length that I need to cut out of the coverlet tape. So again, the coverlet is just to protect the skin, but even with that, people can leave Leukotape on for 3 or 4 days. It survives showers pretty well, not swimming pools. But they always need to sort of give their skin a rest. So the second one is we overlap by about half to a third, and it's going to be behind. Then we come up the leg with the second piece, and it's okay if there's wrinkles in this. So you don't have to be exact with that. Wrinkles don't seem to cause any problems. So we have the ankle taped, and it was okay if we had it in any position. So the real strong tape, the tape that does the job, is a Leukotape. And the Leukotape, it's a little bit of a skill. It takes 4 or 5 times to really get it. You want to have the foot a little bit pronated. So you turn out a little bit and a little bit towards a neutral position. Neutral means that the ankle or the tibia and the foot are in a right angle. So when you put it on, you want to put it on just slightly at a right angle and just slightly pronated. So we make sure when we tape it that we go on the white tape and nothing touching your skin. So, and we have very little tension when we lay it down on the inside of the ankle and the bottom of the heel. So that is just resting. You know, you're not putting any torque on this or pressure. The power is going to be when we come up the leg, and you get a little good at how much tension to do, but you want to put some pretty good tension on this and come up the leg so that you know that you're going to stop just before the end of the white. Again, you don't want any on your skin. So here you pull it on, you bowstring it a little bit, and you cinch it up. And now this is going to give wonderful perineal help to the lateral or the outside ligaments of your ankle and subtalar joint and calcaneal cuboid joint. So I hope that makes sense. It's called a J strap, and it's actually the opposite of what we use for the posterior tib tendon, where we do a J strap the opposite way. So this is a crucial part of a lot of patients who are dealing with chronic peroneal tendonitis and or lateral ankle instability issues, and we're trying to help them either avoid surgery or after surgery stabilize them and keep them as fast as we can out of boots and more structured braces like ankle foot orthotics. So thank you very much, and I hope this is helpful for you.